Hi, I'm Dr. Mary Stouter at Manchester West Veterinary Hospital. I'm here today to talk about kittens and kitten care. I'd like to start out with the medical aspects of kittens. When you first bring a kitten in, we'll be going over a lot of this, and we have summarized our policies for preventive care, spaying, neutering, and even some behavior recommendations in our A1 kitten sheet. First off, the vaccines. Everybody talks about vaccines in cats. There are two core vaccines that all cats require. The feline distemper, which is a multivalent and has several different disease-protecting qualities in it, and the rabies shot. These vaccines will give the distemper shot every 3 weeks until they're 4 months of age, and at that time they get the rabies shot. The non-core vaccines, we like to immunize all kittens with the non-core as well. Feline infectious peritonitis, or FIP, and feline leukemia virus, FELV. We like to vaccinate these kittens to give them a baseline immunity. Then, as their lifestyle changes over the next few years in their growth, it can be judged according to each case whether we should give these vaccines or not. As a rule here at Manchester West, we recommend all the kitten vaccines throughout their life every year to help protect them against unknown circumstances, bringing in a stray kitten, the cat escaping, gives them the coverage. Other things we could talk about is diet. We have other YouTube videos talking about diet and each of these vaccines and such in particular, but we always like to start kittens out with a healthy diet and start them even with some good feeding habits. Perhaps feeding in a toy that drops out pieces of food as they play. And that definitely gives them something to do. Even feeding them in a small bowl so that you can put just a little bit of food in this bowl and you hide it around the house, different areas, under the bed, behind the couch, on a small shelf, so the kittens learn to hunt for their food and not simply go down and graze and gorge on this delicious high-calorie food. Your basic food and water bowls actually just encourage the cats to tend to eat too much. They can always have a base station, but it's better to spread it out. Even water. They often like to drink water at other areas than just in the kitchen. So providing water bowls throughout the house. Heartworm prevention is also something we want to take care of with our kittens, and Revolution is one of our best products for that. It covers intestinal parasites as well as fleas and heartworms. So it covers a broad range because there's quite a bit of exposure to even indoor cats for these parasites. Cats like to eat bugs, bugs carry parasites. Frontline is another source of protection for cats for fleas and ticks. Dental care can start when we're kittens too. Starting with something simple like the chews. These CET chews are quite nice. Actually learning to brush their teeth. They can all help and can start early. The discussion of indoor versus outdoor cats is always a big area, and that there's pros and cons and a number of sources where we can refer you for that, and be glad to talk to you in person. But let's take a look at a little kitten and go over an exam. Laura, our technician, is going to help with her new little kitten. Little feisty thing here. And what's her name?
Annie.
This is Annie. So Annie's going to help us out today. We're going to start with a little distraction. But part of the medical exam, of course, is checking her out thoroughly, getting her used to being checked out, maybe a little positive reward. Now, unfortunately, we do have a vaccine for little Annie when we're done here. So let's go ahead and give her vaccine. So a little distraction, a little scratching. Oh my goodness, she's going to scream. Oh my goodness. There we go. There we go. But we like to do thorough physical exams on all our kittens, handling and checking, and she is all wound up because she's been on the floor playing, but checking their claws and things. So that should summarize our medical care for kittens. Like I said, a lot of these topics are further discussed on other YouTubes, more specifically about heartworms and the vaccines. But on our next topic, I'll be going into how to bring this kitten home and how to socialize them in your home. So thank you very much. I am Dr. Mary Stouter at Manchester West Veterinary Hospital.